Alright, so this morning we'll be looking at some beautiful anatomies. I think I'll be having about 50 presentations where we'll talk about arteries and veins in the lower limb and the upper limb. Okay, we'll be discussing them together so that you see the variations in the hands and also variations in the legs. So the first one we're starting with is the lateral circumflex femoral artery. We get to talk about its anatomy. So just like what we always do, you know, the visual education in anatomy is very, very important. So they said what? Lateral circumflex femoral artery. Okay, of course anything lateral is going away from you, so here you can just see the femoral circumflex. Okay, so the one going medial is a medial circumflex, the one going away is a lateral. Do you understand? So it's not labeled as lateral circumflex, but you could see from the picture. So here has a very good labeling where it actually labels what? The lateral circumflex. This is the main lateral circumflex. This one is a descending branch. Okay, so please you can pause to observe. So what is this vein? We said that it's actually a deep vein and it accompanies the lateral circumflex femoral artery. It collects blood from the hip joint and the surrounding hip muscles. Okay, so it then drains into the deep femoral vein, that's a profunda femoris vein, or directly into the femoral vein. Okay, so it's formed by the union of the ascending and the transverse descending tributaries. So it begins around the proximal femur. Okay, so course, it runs horizontally across the upper thigh and closely follows the course of the lateral circumflex femoral artery. That means if you have a picture showing the arteries too, you see that what is side to side with the lateral circumflex femoral artery. So it ultimately drains into the deep femoral vein, also known as the profunda femoris. Okay. Alright. So this is a deep femoral vein. Okay. So that this drains into it at this region. Okay. So tributaries. It gives rise to the ascending tributaries, the transverse tributaries, the descending tributaries, and the retinacular veins. These ones are around the femoral neck. So what next do we got? Drainage drains the hip joints, the thigh muscles, contributes to the venous return from the proximal femur. Alright, so it lies in relation to the lateral circumflex femoral artery, also communicates with the medial circumflex femoral vein and other tributaries like we've spoken about. So it's very important in hip joint venous drainage. Okay, it's very important in retinacular veins. Okay, and actually serves as a collateral venous pathway in the thigh. Alright, so very important. So this is what we got for the lateral circumflex femoral.